Good afternoon, everyone. This is Jeff Gelblum, Neurology, coming to you from sunny and bright Jupiter, Florida on this end of February, still cold up north winter day. Today's discussion, I think, is something that really impacts all of us right now, all the time. Everyone is so concerned about AI, artificial intelligence. AI in your car, AI when you get an Uber, AI when you order a plane ticket, AI is if it's going to replace accounting or law, AI when you're on Facebook right now, all AI. And one of the commonest questions I always get as a physician is, well, what's going to be the role of AI in medicine? Well, I'm a neurologist, so let's talk about the role of AI in neurology and how is it that we neurologists are using artificial intelligence to help provide better service, better diagnosis, better patient care across the board. What is it that I'm doing, and my group, First Choice Neurology, what are we doing right now in AI that helps you as a neurology patient? What is it that I'm using AI for? Because with all this talk about AI, is it something that's pie in the sky? Or is this something that we're going to be using right now and for the near future? And I can tell you right now and for the near future, many of us in our group, First Choice Neurology, are using AI. So let me tell you how we're doing that. Well, first off, in the neuroradiology space, in order to help evaluate brain MRIs, to evaluate the extent of like Alzheimer plaque deposition, if we see that on a PET scan, or to evaluate the extent of cerebrovascular disease, hardening of the arteries in the brain in folks who've got vascular dementia or stroke. AI programs are very helpful to quantify the degree of Alzheimer plaque that's in the brain, to help quantify the degree of cerebrovascular disorder that's interfering with thinking or language or strength, etc. So AI certainly has an immediate and direct role in neuroradiology. In every MRI that we get nowadays, we know that an AI program has been interposed in that evaluation process, in that impression process, in order to give us a better idea as to things like Alzheimer plaque burden, cerebrovascular disease burden, all of that stuff. So AI is very useful at this point in giving me quantitative levels. Why is that important? Why is quantitative levels important? Quantitative level is important because it allows me to determine the stage of your cerebrovascular condition or the stage of your Alzheimer condition. And then once we initiate treatment, I can see a quantitative response. I can really see how much my treatment is helping. So without a doubt, AI is very helpful in identifying abnormalities on imaging studies that may often escape human eyeballs. So in that regard, there's lots of new programs now looking at AI, artificial intelligence, in the brain imaging space, in the MRI space, to help identify abnormalities such as cerebrovascular disease, Alzheimer plaque burden on a PET scan, etc. So AI has a direct impact right now. So very, very important for radiology, diagnostic imaging, particularly in places like stroke and dementia. Very, very useful, using it all the time. It's not replacing a human radiologist, that's for sure, because we need those human eyeballs to look and see if there's any significant problem. But the AI is useful in really quantifying the degree of the abnormality that we're seeing. So AI makes an important contribution right there. In that radiologic diagnostic space, very, very good, very helpful, very useful and very beneficial for not only patient assessment, but management and eventual outcome. So super important in that regard. Another area that we at First Choice Neurology are really making a big push in AI is taking all of our data, meaning all the patient data. Whenever you come in, all that chart is filled out. Well, that's data. All of that data gets de-identified, meaning it doesn't get assigned to any certain patient. But we look at all of that data macroscopically across our entire universe of patients. So for example, if I want to say, hey, how many 55-year-old females with a cognitive impairment also have a stroke, I can look at all of that data instantly and come up with a number. And with that, we can see what are the treatments that seem best to help that condition. So you're saying, wait, I quite don't understand. All right, so if you come to me as a patient right now, let's say you come to me and you have a condition of Parkinson's, and I start you on a treatment for Parkinson's. Well, I'll say, okay, 55-year-old woman with Parkinson's, I'm going to start an old-fashioned medicine called carbidopa-levodopa. Well, you as a patient are naturally going to ask me, hey, doctor, overall, what's my chance of progressing with my Parkinson's based upon my clinical situation? That's a natural question. I would ask that question of any doctor, and I need to be prepared to respond to it. Well, back in the day, before AI, meaning before 2 years ago, the only thing I could say is, look, you've got Parkinson's, you're middle-aged, this is the age of onset, this is the stage of the Parkinson's, this is what we think will happen based upon peer-reviewed publications that have been out there in the literature for the past 10 years. But I can't really, or I haven't really been able to say, but this is what I know to be true in our overall practice. Our overall practice now, with the benefit of AI and being able to utilize all the data, not only from myself, but all my other colleagues at First Choice Neurology and other large practices around the country. All that data is now sitting in a central repository. We call that Neurodiscovery AI. We've got all that data now sitting in a central repository. It's not identified patient-specific, but it's compiled in terms of the overall data points that are part of the medical record. So all that data is now sitting in a central database. I can now respond to you as the patient, middle-aged woman with Parkinson's, and say, look, this is where we think you're going to be at the next year, the next 5 year, the next 10 years. This is extremely powerful because it allows me not only to select treatments that are going to be optimized for your specific condition, but it's going to allow me to give you an idea as to prognosis and trajectory of condition. People need this information. We all want to know where we are and where we're going to go and where we're going to end up. Very important for life planning, for diagnosis, for management, for medication selection, for all sorts of things. And AI, for the first time in human history, really allows us to be able to say with some degree of confidence, like, look, middle age, Parkinson's, starting you on a certain medication, like, let's say, levodopa, based upon our AI platform that we're now sharing data with millions of other patients, with many other diagnostic neurology treatment centers around the country and around the world. I'm now able to say, look, based upon what I see with you, this information is also shared in common with about 3,000 other people. This is where they're going. This is very reassuring to me, to my patients, and to the medical community as a whole. So this is where AI is taking us. AI is taking us into a spot where when I look you face-to-face as a patient, doctor-patient, and I say, look, this is what I'm seeing, this is my diagnosis, this is my treatment recommendation, then your next question to me can be, well, doc, how's this play out over 1,000 people or over 10,000 people? Because of AI, I'm able to now quickly plug that information into my computer that's sitting on my desk using a platform like Neurodiscovery AI. We're now able to respond in a meaningful way, saying, look, over the next 10 years, things should be pretty good. That is the most amazing and powerful information that we as neurologists can share. So clearly, AI, each and every day, right now, February 27, 2026, is having a meaningful impact in how I'm able to help you as a patient. And First Choice Neurology, that's our treatment group. First Choice Neurology, we're using our data compiled system-wide to help give patients better treatment decisions, better treatment algorithms, better medications, all the things that are important to give you an idea as to how you're best going to function today, tomorrow, 5 years, 10 years. So this is all very exciting news thanks to AI. So a lot of people say, oh, AI is one of these pie-in-the-sky things. Who knows where it's going to bring us? I can tell you in our practice here at First Choice Neurology, we are using AI right now, each and every day, to make treatment decisions because we're able now to harvest, to compile, to look at data and treatment trends, to be able to give you the best specific regimen, the best specific program that we can. And that's where AI is having a great impact. So immediately, today, how did AI impact my practice? This morning, Friday, February 27, 2026. What did I do with AI that helped my patients this morning? I'm using AI in my radiology tools to help evaluate your brain MRIs to see how that vascular disease is, how that Parkinson's is, how that dementia is, Alzheimer's is. We're using it for epilepsy management to see trends on your electroencephalogram, to make sure that we're capturing seizures if they're there and then treating them effectively. And then on a really macroscopic basis, we're using shared data within our group, our large group, First Choice Neurology, as well as other affiliated groups around the country to see what are the best treatment programs, treatment trends that are having real-world impact and real-world benefit. And this is far different than just going into the literature and saying, hey, what was that report from New England Journal of Medicine back from 6 years ago? Not about that anymore. It's about getting real-world information that allows us to provide up-to-the-minute best treatment programs, algorithms, regimens for our patient. So that's the beauty of AI when it comes to clinical neurology practice. And obviously, we're going to be back many times over the next year or so to give you updates as to how AI is going to directly impact your care and treatment in the neurology space. On just a nuts and bolts practical level, nowadays we're using AI. So when you call the office and say, hey, I need my medical records, that AI program can quickly respond because it's got voice recognition when you call to quickly get you your medical records or send them to Dr. Joe Smith, who's your primary care or endocrinologist. So AI is very useful now on the front end of our practice to help direct and help digest and integrate all of your patient requests that sometimes, you'd have to wait on hold for. So AI is really helping in that regard, smoothing up the practice flow. So here we are, February 27, 2026. You're hearing a lot about AI. Always you hear about NVIDIA and all these things. AI, Facebook AI, AI this, AI that. Well, I'm telling you that from a clinical neurology perspective, right here at First Choice Neurology, we are using AI to not only better manage your processing in the office, meaning coming in, getting the records you need, all the logistics of insurance, authorizations, this type of stuff, but we're really using it on a face-to-face basis to help better evaluate and better manage whatever condition you've got that's a neurological disorder. So I've mentioned some of those conditions: MS, epilepsy, migraine, Parkinson's, Alzheimer's. All of this is amenable to AI data capture so that when we plug into that program here in our office, we call it Neurodiscovery AI. When we plug into that program, we're able to say, look, not just alone from my perspective, but based upon the experience of 5 million patients in a database, because that's what we've got access to. 5 million patients in a database. This is the best possible treatment for you at this point in time. So all of this is extremely powerful. So I want to remind you that we at First Choice Neurology, we're in the treatment business of neurology. But when we sit here and make these complex medical records, and when you go online and look at your records and see all this stuff, it's all now being integrated in a way that allows us to not only take our individual experience as a physician, as an individual treater, but share that information with my other First Choice Neurology colleagues and other colleagues, other neurology colleagues around the country. All of this is going into a spot that allows us to really give you the best overview of your condition and the best treatment program. And for those practices who aren't using AI, I feel sorry for them because they're missing out on the shared intellect, the shared data, the shared treatment perspectives of lots of other physicians. So, my philosophy is my 2 eyeballs are good, but if I can bring in the expertise of 1,000 other eyeballs and give that data to you, well, that means a lot in the diagnostic and treatment space. And then finally, I invite you all to make an appointment with one of us neurologists if you have a specific neurological concern, memory, pain, energy, sleep disorder, because we do a very good job now of not only evaluating but treating. And it's not just about personal treatment, but it's about the shared experience from thousands of other neurologists and what those outcomes are. And that's where the AI data assessment is. And that's what we're making use of right now in First Choice Neurology. So please, if you've got a neurological concern, go on fcneurology.net, look at the website, go and make an appointment for yourself or a loved one if you've got any specific conditions that you think need further evaluation. But rest assured, when you make that appointment, we're going to be using AI to help define your condition and help come up with best practice, best treatment algorithms for you. If you just want to have a quick chat with one of us, there's neurotogo.com, which is our patient outreach platform for you or a loved one. Call. You don't even need any insurance. Make an appointment. It'll be a nice chat to discuss a condition that's of concern to you. And then as part of our commitment to dementia, we've got our Memory Centers of America, which heavily relies upon AI input to really give you the best overview as to ideal treatment, prognosis, diagnosis, and where the best treatment trajectory will be to give you the best possible outcome. So if you go into your office, your doctor's office, and they scratch their head when you say, "Hey, are you using AI?" and they say, "What do you mean by that?" Well, maybe it's time to pick up the phone and call First Choice Neurology, because we rely upon AI and are using it in our practice. And we've got a whole technology committee that really makes sure that the care we're giving is really up to the minute as per the latest and greatest of February 27, 2026. And that's where I'm going to be coming back to you over the next few months, telling you about how advances in AI are really impacting our care and treatment of you. But right now, data sharing, imaging studies like MRI, EEG, all of this is heavily influenced and heavily benefited by the current state of AI technology. And we're using it each and every day. And I can tell you this morning with my morning patients, I used it to really give some very important data and treatment recommendations. So I appreciate your time today. AI is part of neurology. It's not going to replace me or my brain, but it's certainly going to help me, Dr. Gelblum, and my brain to give you the best possible care that you can get. And I appreciate your time, and we're going to be bringing you lots of updates about the emerging target and platform of AI and how it benefits neurology. So I'll look forward to seeing you. And any questions or concerns, we're here for you. I'm here in my Jupiter office. I'm here in my Aventura office. And with that, we're committed not only to giving you the standard of care, but what will become the new standard of care. And that's where we're going in this practice, and that's where neurology should be going.